Next presenter, Dr. Diana Nguyen. She's a Health Science Associate Clinical Professor and Chief of the Division of Clinical General Dentistry at the UCSF School of Dentistry. After graduating from Columbia University and receiving her Doctor of Dental Surgery degree from NYU College of Dentistry, she completed a general practice residency at Yale. She is Fellow of Academy of General Dentistry, American College of Dentists, International College of Dentists, and Peer Food Chart Academy, as well as a published author and nationally recognized speaker who has been quoted in Wall Street Journal, Forbes, and the New York Times. Dr. Nguyen currently serves on the board of directors for the San Francisco Dental Society and is a faculty ambassador for the American Dental Association. In 2024, she received the Gates Award for the Junior Faculty Achievement in Oral Health Education from the American Dental Education Association and Idea Gates Foundation, and she's presenting as part of a spotlight on clinical excellence. And title of her presentation is Clinical Education as a Catalyst for Leadership Development.
Oh, phew. All right, good morning. Hello, everyone. Thank you so much for having me today. I can't tell you how excited I am to have been invited to be here and speak with you this morning. So thank you to the Research and Clinical Excellence Day Committee for allowing me to share the stage with some of the most brilliant and accomplished and impressive minds that I have ever had the privilege of seeing up close. To the first and second year dental students sitting in the audience today, I am delighted to be here. And I look forward to welcoming all of you to the Predoc Clinic for the next phase of your hands-on clinical training here at UCSF. As Chief of Clinical General Dentistry, I oversee clinical operations across all of our group practices and also help to support faculty development and work closely with our students to ensure that their clinical experience prepares them to deliver exceptional patient-centered care. So, when we talk about clinical excellence, it's often framed in terms of precision, technical expertise, or adherence to evidence-based protocols. And all of those are very important, of course. But what I've come to realize over the years is that clinical excellence is also a pathway to something bigger, developing leaders. Every decision we make in the operatory, from interpreting radiographs to managing patient expectations, is also an exercise in leadership. And if we choose to reframe clinical education through that lens, then every patient encounter then becomes a training ground for the next generation of leaders in the dental profession. So today, I'd like to share a few examples and innovations that illustrate how this plays out in our clinics and how it prepares our graduates not only to be excellent clinicians, but also visionary leaders who can inspire teams and transform the future of oral health. I'd like for all of you now to travel back with me to the year 2010. This is a patient that I treated when I was a dental student. I still remember the first appointment. 33-year-old female who presented to the clinic with a chief complaint, I just need a cleaning. All right, be honest. How many of you, looking at these photos up here, are thinking to yourselves, just a cleaning? Lady, are you sure about that? I will admit, as a student, this case terrified me. In that moment, sitting across from her, I felt completely overwhelmed and totally unqualified to help her. It forced me to really wrestle with some very humbling questions. Like, what do I actually know about what's going on inside her mouth? How can I be sure that what I recommend for her is going to be the right treatment? And why do her gums look so angry? Looking back on this case now, I can see that it wasn't just about getting through a comprehensive exam. It was my very first lesson in healthcare leadership. As this patient's new primary dental provider, that meant taking responsibility for making accurate clinical diagnoses, guiding her to accept my treatment recommendations, and taking ownership of the outcomes of her care. Think for a moment about what our students do every single day in the clinic. They look at the x-rays, in the mouth, they take measurements, they read test results in the patient's chart, and they try to pinpoint what's wrong or what could be improved. They review those recommendations with a faculty member, defending the rationale behind their recommendations and thinking. And they explain it to the patient. They agree on a treatment plan, and then they get to work to carrying it out. To put it very simply, their clinical workflow is diagnosis, then communication, decision, and then action. But if you zoom out, you realize that it's also a workflow for leadership. Making a diagnosis requires analysis, weighing evidence, making sense of complex data. Communicating that diagnosis requires empathy and clarity. Deciding on a plan requires judgment and accountability. And taking action requires courage and follow-through. One of the most powerful arenas for developing leadership is communication. It's easy to give good news, but much harder to sit across from a patient and tell them that the treatment they need, or that they need treatment that they weren't going to be expecting, or that the care will take longer, cost more, or involve risks that they may not be comfortable with. Our students and faculty navigate these conversations daily. They encounter patients with different levels of health literacy, expectations, and sometimes very different ideas about what their care should look like. To succeed, clinicians need to practice compassion to see the situation from the patient's perspective. They need fluency to distill technical information into something a non-dental person can understand. And they need adaptability to shift their message based on the patient's background, language, or concerns. These aren't just clinical skills, they're leadership competencies, and our dental clinic is one of the best classrooms in the world to practice them. That's where our faculty come in. We're not just checking preps or signing off chart notes, we're coaching future leaders in healthcare. Think of all the times that you've watched someone stumble through explaining something or freeze when they realize that they don't have all the answers. When that happens in our clinic, our role as faculty isn't just to correct them, it's to model resilience, critical thinking, and empathy. We create a safe space for our students to think critically, ask questions, and reflect thoughtfully on what every patient interaction can teach them. And when they succeed, we celebrate not just the injection that they gave or the crown that they seated, but the confidence, judgment, and professionalism that they demonstrated at every step along the way. Teaching effective patient communication is at the heart of leadership development in clinical education because the same skills that make someone a strong communicator with patients are the ones that make them an effective leader. When students learn to listen with empathy, explain with clarity, and build trust with their patients, they're also practicing how to motivate a team, de-escalate conflict, and create alignment, the core functions of leadership. Communication in the clinic isn't just about delivering information, it's about connecting with people in moments of vulnerability. That's what leadership looks like. It's emotional intelligence in action, being able to read the room, adapt your tone, and help others feel seen and understood. And so for our faculty, teaching communication means modeling it ourselves, giving feedback that's specific and kind, guiding students through difficult patient interactions, and demonstrating that professionalism is not just about what you say, but how you say it. All right. Now, even with dedicated faculty modeling leadership, empathy, and resilience for our students, the truth is that there are times when the system itself can face incredible strain. Coming out of COVID, we had far fewer faculty and administrative support than before. The doctors who were left were balancing heavier teaching loads while also learning how to navigate EPIC, our new electronic health record system. And at the same time, our learners were facing uneven clinical exposure and difficulty accessing those resources equitably. So with the critical faculty shortage and reduced staff, we had to get creative to meet the challenge of continuing to provide our learners and their patients with the best experience possible. So we had to ask ourselves, how do we leverage what we already have? The solution was to tap into the leadership potential of our most high-performing fourth-year students, those who'd consistently demonstrated clinical excellence, sound ethical judgment, team player mentalities, and the ability to communicate effectively and clearly. We designated these students as D4 chiefs within their group practices. This innovation started as a small experiment in just one group practice, mine, and ultimately grew into a program that was adopted across all of UCSF's group practices within 2 years. D4 chiefs are real-time, in-clinic resources for their peers. They jump in to assist chairside with a challenging patient, troubleshoot issues that their fellow students are having with EPIC, and support strategic scheduling coordination. Most importantly, they model best practices to the students around them. Their presence helps to create a sense of shared ownership and accountability in their group practice. The outcomes are immediate and meaningful. More collaboration and peer-to-peer learning. A clear point person or persons for technical and logistical support when attending faculty are busy helping other students. And a tradition of clinical excellence led by students who inspire others to rise to the same standard. The D4 Chiefs initiative is built around 3 simple but powerful steps: engage, entrust, and elevate. See what I did there? All right. First, we engage. At UCSF, students are assigned to their group practices in their first year. That means, as group practice leaders, GPLs, we know from the start which students we'll be mentoring throughout their clinical journey. I use this early window to identify students with strong potential, those who have already demonstrated leadership, a collaborative spirit, and an outstanding work ethic. And I begin investing in them long before they've treated their first patient. So yes, D1s and D2s, I am watching you. Next, we entrust. By their 4th year, these students are appointed as D4 Chiefs, and they play a hands-on role in supporting their peers, attending faculty, and the clinic operations team. They act as a bridge between students and leadership, supporting day-to-day clinic operations, reinforcing professional standards, and helping to identify and resolve challenges early. Working closely with faculty and the GPLs, they ensure that the clinic runs smoothly while modeling the collaboration and accountability that we expect from future dental professionals. Finally, we elevate. We make sure that these students are recognized for their contributions, not just with the title, but by creating a sense of ownership and purpose that lasts beyond graduation. Here's a former D4 chief who came back to UCSF as an immensely popular and productive part-time instructor. I make it a priority to invite outstanding chiefs who performed brilliantly as students to return as faculty and continue to nurture them as clinical educators. Our students look up to them as role models who have been in their shoes and are now giving back to UCSF. This is humanistic dental education in action. It also creates a pipeline of future faculty and a succession plan for our institution, not just for strong students, but for future leaders in dental education who already feel deeply connected to the mission and values of our school. When we talk about clinical excellence in the predoctoral clinic, it's not just about the quality of a single procedure. It's about the culture that surrounds the care that we provide. The D4 Chiefs have been a critical part of shaping that culture. First, their presence sets a tone. These are students who exemplify strong clinical judgment, professionalism, and ethical decision-making. By modeling those qualities, they raise the bar for everyone else around them, not through authority, but by example. Patients and students can see and feel that clinical excellence isn't some abstract concept that we're trying to achieve. It's already here because our chiefs are living, breathing, and upholding it through everything that they do. Second, the role itself develops real-world leadership and communication skills. Chiefs learn how to navigate clinic dynamics, manage patient flow, and serve as a bridge between faculty, staff, and students. Those skills directly support clinical excellence because a well-coordinated clinic is one where patients are seen on time, emergencies are handled smoothly, and students feel supported rather than overwhelmed. And third, the chiefs promote true team-based care. Their leadership has created an environment where students share knowledge, step in to help one another, and problem solve together. The result is a clinic that runs more efficiently and feels more collaborative, which mirrors the team-based care models that our profession is moving towards. So in short, the D4 Chiefs don't just help the clinic function, they help it to thrive. Their impact is reflected in the mentorship that they provide, the leadership they practice, and the culture of excellence that they inspire. Let's talk about an obstacle to achieving clinical excellence, the struggle to serve walk-in patients and those who are stuck waiting weeks or even months for an appointment. Sure, some patients come in without a scheduled appointment because they're looking for convenience, but honestly, most of them are looking for relief. Until recently, even when students were technically available, the front desk had no reliable way of finding them. Staff were too busy to search the clinic to track down an available provider, and sometimes a student who looked open on the schedule had already packed up their chair because they had no patient booked and nothing to do. So for patients, the odds of being seen for an emergency were pretty low if you weren't one of the very first people to walk in at the beginning of the day. And likewise for students, if you weren't pre-assigned to take emergencies at the start of the clinic session, you often lost out on opportunities to grow your patient roster and gain more clinical experience. This is our student clinic at the dental center. 1 floor, 80 chairs, divided into 5 distinct group practices. Under our previous system for walk-ins, each group practice had just 1 chair designated for taking unscheduled emergency patients during each clinic session. Once those were filled, there was no clear way to know if anyone else could be seen, whether they were in pain, hoping to establish care, or frustrated after phoning the call center and hearing about our long wait times. And every time we had to say, "We're sorry, but we've reached our capacity for today," it represented a real missed opportunity, not just for patient care, but for education. Students were losing out on teachable moments in diagnosis, triage, and communication. We knew that we had to disrupt the system and come up with something better. So in April 2025, we reimagined, redesigned, and launched a new system designed to shift from scarcity to patient-centered access. We set a goal to see every patient who walked in, whether it was urgent or not. Under this initiative, we were leading patient care with an entirely new mindset, which is that nobody gets sent away without every single person in this clinic doing everything they possibly can to help them right away. We created a centralized communication hub where group practice leaders and D4 chiefs could coordinate in real time with staff in our dental center lobby and the front desk. So this allowed faculty leaders to quickly match match our walk-ins to students who had same-day cancellations, patient dismissals, or upcoming availability. By making this process faculty-led with the support of our D4 chiefs and our spectacularly dedicated staff, we not only improved efficiency, but also ensured that patients were connected to students who needed clinical experience and wanted to help, creating a win-win situation for everyone. The system maximized chair utilization, ensured that our resources didn't sit idle, and conditioned our students, faculty, and staff to not only be prepared for last-minute additions to the schedule, but to expect and aim to manage more than 1 patient per session, a critical skill for anyone working in residency, private practice, community health, and any other clinical setting that our students might find themselves in after graduation. So what was the impact? In just under 6 months, the new system has now accommodated over 2,000 same-day patients, a dramatic increase from the past. But the numbers only tell part of the story. This new workflow modeled adaptability, teamwork, and a commitment to serving patients first. So we're not just performing procedures, but designing systems of care that are equitable, efficient, and patient-centered. So now our students are leaving UCSF with those lessons programmed into their professional DNA. When we launched the new walk-in patient process, it wasn't just an operational change. It was a leadership exercise at every level of the clinic. For our students, it required adaptability, communication, and confidence. They had to think on their feet, triage patients, and collaborate with their peers and faculty to make real-time clinical decisions. And that meant developing judgment and teamwork skills that go far beyond what you can learn from a scheduled appointment. For our staff, it was an exercise in coordination, communication, and systems thinking. Managing unpredictable patient flow meant everyone had to stay aligned and proactive, not reactive. And for our faculty, this process called for trust and coaching rather than control. It pushed us to model calm under pressure, demonstrate situational leadership, and create psychological safety while still maintaining efficiency and high patient care standards. In other words, the walk-in system didn't just expand access to care, it expanded our leadership capacity. Every person in that process, from front desk to faculty, had to demonstrate initiative, accountability, and a commitment to our shared mission. So ultimately, this project helped to strengthen the muscle of leadership across clinic, leading through uncertainty, collaborating across roles, and staying focused on patient care outcomes, even when the path wasn't predictable. Over the course of my career, I've had the privilege of teaching, learning from, and collaborating with hundreds of scholars and clinicians. And what I've learned that is in dentistry, success is never just about the metrics or the data points. Excellence isn't measured in the number of procedures you've completed or how quickly you can get your patient in and out of the chair. It's defined by something so much deeper. The connections you make, the creativity you demonstrate, and the compassion that you apply to every patient interaction. Leading others to success, whether it's in patient care, education, or research, is rarely comfortable. It asks you to step into uncertainty, to make decisions without perfect answers, and sometimes to stand apart from the crowd. But within that discomfort lies the possibility to reimagine what's possible and to find solutions for the people who need it the most. Every time you care for a patient, you lead the way, and often a team, towards clinical excellence. And when you multiply that across every time you step into an operatory, you realize that you're constantly playing the role of a leader, even if you don't realize it. Our graduates are entering a profession that's more complex than ever, balancing patient care, team management, compliance, technology, and often while they're teaching or running practices of their own. Technical skill alone isn't enough to navigate that landscape. Leadership is what helps clinicians communicate across disciplines, adapt to change, and make sound ethical decisions under pressure. It's what bridges the gap between knowing what to do and guiding others to do it with confidence and compassion. You know, historically, the spotlight on clinical excellence lecture has always been given by an experienced, actively practicing clinician, someone who's asked to share examples of their own patient care, pictures and radiographs and images that make the audience go, wow. Cool cases, complex procedures, the kind of work that makes you sit up a little bit straighter and think, oh man, that's what excellence really looks like. And the way it's set up, it sort of makes you believe that clinical excellence is this label that's only reserved for the best of the best, something that you have to chase until you feel good enough, accomplished enough, and experienced enough for people to look at your work and say, I need to get myself on that level. So here's the part that I'm really not supposed to tell you. Clinical excellence isn't a destination. It doesn't exist anywhere on a map. You don't just get there and then you're done. At its core, clinical excellence is a mindset. You unlock it, and it motivates you to help continue to refine your skills, refresh your knowledge, and deliver the best possible care that you can because you believe that your patients deserve nothing less. That mindset is what separates good clinicians from great ones. And it's also what defines a leader. Because leadership in dentistry and healthcare isn't about standing above others, it's about standing beside them, setting the tone through your actions, and leading by example. I'd love to continue this conversation with all of you, but we all have to go to lunch. So I hope to hear about your experiences, your perspectives, and your questions. So please be sure to connect with me and say hello at some point today. Thank you so much.